Alright, good morning class. Today we're going to be talking about wound healing promotion and scar prevention in burn victims ages 40 and up. First, we're going to talk about the burn phases. Understanding these stages will help you know what to expect and how to take care of yourself as you heal. According to the American Burn Association, burn healing follows these predictable stages, which help guide our care and expectations for recovery. There's 3 phases: inflammatory, proliferatory, and maturation. The first phase is inflammatory. This lasts from the first few days to weeks after the burn occurs. This is your body's first response to the injury. It focuses on protecting the area from infection and start the healing process. During this phase, you may see redness, swelling, and pain. These are all normal signs as your body works to prevent infection and start the repair process. The next phase is the proliferatory phase. This lasts weeks to months. During this phase, it's all about rebuilding the skin. New tissue begins to form and the wound starts to close. During this phase, you might notice that your burn may look pink or light red. These are all also normal signs, and it is because new blood vessels are being formed to nourish the area. It is important during this phase to keep your skin moisturized and protect from infection. We'll talk about this later and how to moisturize it. The third phase, the last phase, is the maturation phase. This can last months to years. This is where the skin strengthens and the scars begin to form. This phase can last over years. During this phase, the scar will change in appearance and sometimes become lighter and flatter over time. Some techniques that we'll discuss later are gentle massaging and silicone sheets. At the end of this, I'll be providing you with a handout from the American Burn Association that summarizes these stages and gives you additional information about scar management. All right, now let's dive into preventing and minimizing scars. By the end of this session, you'll be able to identify key strategies to prevent and minimize scarring and demonstrate proper techniques for scar management. I'll be giving a 5-question quiz at the end of this lecture, summarizing the key points we discussed. Today we'll focus on hands-on techniques. I'll show you how to use products and apply practices to help your scars heal properly. We'll also engage in guided practice. I'll help you practice massaging your scars with emollients, which is a key technique in scar protection. First, let's talk about silicone sheets and pressure garments. These are commonly used to reduce scarring after a burn injury. Research shows that silicone sheets and pressure garments apply gentle pressure and moisturize, which help prevent excessive scar tissue formation. I will demonstrate how to apply a silicone sheet properly and then ask you to show me how you would use it. Remember, you should wear silicone sheets or pressure garments for several hours a day or advised by your healthcare provider. Next, let's talk about massaging with emollients. These are like non-scented moisturizers and oils. This technique helps the skin stay hydrated and promotes elasticity, which is commonly decreased after burns. When using these, you're going to massage the scar in a gentle circular motion. This helps to reduce scar thickness and improve the overall appearance of the skin. I'll demonstrate the proper technique and then you'll have a chance to practice yourself. This should be done twice a day using a gentle, non-scented oil or cream until the scar matures. After I demonstrate and get through the teaching, I will provide you with that 5 quiz to test your understanding of the knowledge I provided you with today. All right, the last thing we're going to discuss is ways to protect healing the skin from sun exposure and other environmental damage. By the end of this, you'll be able to at least demonstrate 2 strategies. We will focus on the physical hands-on learning. You will demonstrate how to use sun protection techniques in real-life scenarios. You'll then engage in a role play where you will act out scenarios of being outside in the sun, and I'll observe how you apply sunscreen, wear protective clothing, and seek shade. One of the most important steps in protecting your healing skin is using sunscreen. It helps shield your skin from the harmful UV rays, which can cause further damage to your delicate healing tissue and increase the risk of scarring. I'll demonstrate how to apply sunscreen evenly to all exposed areas. You should be using a sunscreen with an SPF of 30, at least 30, and apply it 20 minutes before going outside. All right, now let's role play. Imagine you're headed outside on a sunny day. I want you to demonstrate how you would apply sunscreen to your face, arms, and any exposed areas. In addition to sunscreen, wearing protection clothing is essential to keep your healing skin safe from the sun and exposure. Like I mentioned with the SPF sunscreen, I want to make sure that you're covering all bases of your skin. So say you're focusing on all your face, you can dabble around the face so that when you start to rub it in, it evenly covers all surface areas. You don't want to add some over here and miss other spots. All right, back to the protective clothing. Clothes like long sleeves, hats with wide brims, and UV blocking fabrics will help protect your skin from the sun rays. Another simple way to protect your skin is by seeking shade during peak sunlight hours. These are typically between 10 a.m. to 4 p.m. Spending time in the shade will limit your direct sun exposure, reducing the risk of further damage to healing your skin. This can be places under trees, umbrellas, or any shaded areas outside. To help you remember these key tips, I've created a checklist of things to do before going on the sun exposure. This will include everything mentioned, and we'll go over it one more time. Applying sunscreen 20 minutes before sun exposure. Reapplying sunscreen every 2 hours, especially if sweating or swimming, because that can wipe off all of your sunscreen and reset everything. Wearing long sleeves, a wide brim hat, and sunglasses to protect your skin, and seeking shade during those peak hours, which, as I mentioned earlier, is from 10 a.m. to 4 p.m. That about summarizes everything I have for tips and preventions for sun exposure, skin healing, and scar prevention. Thank you for participating. If you have any questions, feel free to ask. I will attach the 5-question quiz and the handout for remembering the key tips. Thank you.